My name is Amanda Pratt, licensed clinical social worker with Imagine Life Therapy. I'm a therapist based out of St. Petersburg, Florida, who specializes in working with people with chronic illness, help them manage their disease, and process all the different experiences they have as a result of that. I want to talk a little bit today about something that came up this week in a session, and that is trauma as a result of chronic illness or medical experience. I think that a lot of people don't really realize how susceptible we are to trauma relating to medical environments or coming into contact due to an illness or a medical reason. One of the ways that we can experience trauma is through just being in the medical environment and experiencing something that is traumatic or perceived as a crisis. For most of my clients, and I know me personally, getting diagnosed or even the experience of having to enter the medical system, the healthcare system, when you start experiencing symptoms and maybe don't know what's wrong, can be traumatizing in and of itself. And so usually that is the access point to the medical field, the healthcare field, and that access point in and of itself can be traumatizing. Many times we don't know what's wrong and we go into a doctor and they may not know either, or they may not find anything wrong with you, and so they might invalidate you or kind of give you the feeling like they might think that there really isn't anything wrong with you. So that experience can be traumatizing. Sometimes getting the diagnosis after going through the journey of having tests done and experiencing symptoms and sharing those with a doctor can be traumatizing as well, because maybe you get diagnosed with something that is a chronic lifelong disease or it's incurable, and the very idea that you might have something you have to live with for the rest of your life can also be traumatizing. Being diagnosed with a chronic illness in and of itself is one of the top most stressful events a person can experience, and so it's really quite natural to think or logical to think that the experience of getting diagnosed with a lifelong illness would be traumatizing. And I think that anybody who has that experience or the feeling like they were traumatized at that moment, I think that it's okay to understand that that is a really tough thing to go through. Some other things that can be traumatizing about having a chronic illness are treatments. Sometimes treatments require surgery, and surgery can be a traumatizing experience. Sometimes treatments can be really almost violating, where say you get a treatment done that puts you in a vulnerable position. Like, a lot of gynecological treatments deal with areas of your body that you don't typically have someone poking around unless you choose for that to happen. And so that can be a really vulnerable thing. And anytime we're in a vulnerable position, especially if we're having to get a treatment for something, that can be traumatizing. Sometimes people get misdiagnosed with things and don't find out until years later. That can be traumatizing. There are just so many ways that people can be traumatized in healthcare and in the medical field in general. So I wanted this post to kind of validate that for people and to explain, maybe help someone put a name to something they might be feeling. And so medical trauma is anything that puts you in a vulnerable position, makes you feel as if your life is at risk in some way. And it's something that can stick with you. It can just be having a bad experience where you have lost control in the situation, and that really negative experience sticks with you. Sometimes you can have nightmares about it. Anything that's typical PTSD symptoms, which would be flashbacks. You might have things that trigger you in that environment, like a smell or a touch or a feel of something, or even just being in a certain environment can trigger you. Could be noises, just silence in general. And that could cause you to kind of feel those negative feelings again. So for anyone who experiences any of that, I just want to say that, I definitely empathize with you. I think everyone I've talked to that has a chronic illness has had some kind of negative experience to that end in some way, unfortunately. So I want to give you a couple things that you can do to fight that. One of the things that we do for PTSD symptoms is to kind of, number one, recognize the triggers. Try and jot down or make a list of things that trigger you to feel those feelings or that fear, again, that might be related to that. The second thing is to face those triggers. You never want to avoid something that triggers you unless it's so pervasive that you really can't emotionally handle it. Then you want to break it down into small exposures. But if it's something that you feel like you can face and you can deal with that kind of uncomfortable feeling temporarily, you definitely always want to face it, because over time what's going to happen is, say you are triggered by a smell. If every time you smell that smell, like say I'm triggered by the smell of lavender, if I go driving by a lavender field and I smell it, it might trigger uncomfortable feelings. But if I avoid lavender at all costs, then I'm not retraining my body or taking the steps to retrain my body and my mind to realize that lavender in and of itself isn't unsafe. Okay, so you want to still let yourself be exposed to those things. Then what you want to do is you want to really change your self-talk around that. Okay, I'm smelling lavender and I'm feeling anxious. Why am I feeling anxious? I'm feeling anxious because of something that doesn't have to do with the lavender. The lavender in and of itself is not a danger to me. It poses no risk to me. And the more times you do this and the more times you're exposed to it and you can tell your body and your mind that that thing is not dangerous in and of itself, then over time you're going to reprogram your mind and your body to not recognize that as a dangerous thing anymore. Essentially what's happening when you're being triggered by certain sensory things is that when we're in a situation where we feel vulnerable or we are traumatized and we feel like our safety is at risk or we don't have control over what happens to us, our body and our mind make a mental note of all of the sensory information that it's taking in at that time. And that feeling that you have, that emotion, that experience is essentially stapled to the memory that you have of all those sensory things that happened. Anything you see, anything you hear, anything you smell, anything you touch can be stapled to that feeling of fear. And so what we need to do is unstaple it over time by exposing yourself to those things and showing your mind and your body, okay, that thing does not equal fear. And you'll essentially reprogram. It takes time. It's something that can be done with the help of a therapist, and it's something that can be done in small chunks or in whatever way that you can handle it. So that is the best way to kind of approach medical trauma or any kind of trauma in the healthcare field when you have a chronic illness. And again, this is so complex. This is just one little piece of it. If anything I've said doesn't resonate with you or your specific experience doesn't really fit into this, that's okay, because there's so many different types of experiences out there that yours may be very unique. And so usually what I do is customize a plan for each client that is specific to their experience and their triggers and their whatever they're able to handle in that moment. And so that's kind of what's so great about therapy, is everything can be customized exactly to you, so it works for you and it's at a pace that you can handle. So all right, well, that's all I wanted to talk about today. If you have any questions, please feel free to drop a comment or email me at amanda@imaginelifetherapy.com. And I am taking new clients. I offer online therapy in the state of Florida, and I offer in-person sessions in St. Petersburg, Florida. So again, if you are looking for a therapist, feel free to message me. I have a few slots available, so I would love to talk to you. All right, bye.